Good afternoon. My name is Rebecca Winter. I work for the Association for Promotion of the Healthcare Industry in the region Leipzig. And I'm here today to introduce the InterregCE project to you, which is called digitalLIFE for Central Europe. Before introducing the project, I like to face you with some playthings you might know from your childhood or your children. When you look at those Lego stones, you easily get a similarity how the innovation system in Europe works. Here you see bricks that you can easily connect, that have similar shapes, colors, and which are here not yet connected. And this is actually the same when you take a closer look at the innovation system in Europe. You are faced with the fact that due to a variety of digital agendas in the countries of Central Europe, you have a lot of innovations that are similar to each other. You have funds that support similar solutions. But the question is, why do we all have that isolated and not putting that together for just gaining a deeper solution for every European country and, in summary, for every European citizen regarding digital healthcare? So the fragmentation I just showed is a very, very interesting point for our project, because what actually does the fragmentation mean? It means that all innovations need a longer period before they enter the market, and it also has a cost effect because it doubles cost, and things are funded in one country which are already developed in another country and are probably needed in all countries. So it takes time until at least the patient can benefit from the digital innovation in the healthcare system. So which role does digitalLIFE play here? Well, in digitalLIFE we have 9 partners from 7 Central European countries, and our partners come from the policy part, from R&D institutions, from associations, technology parks, and so on. And we all work together for bringing the innovation into the markets, into the integrated healthcare systems by just using our networks. So this is a little overview to give you a nice visualization here how our network is. And the thing is, what do we want to do facing this problem and bridging the gap with all the fragmentation in the innovation system? Well, in this constellation that we work in, we want to create a Central European area of excellence, combining all the innovation that are available and just opening the doors into the integrated healthcare system solutions. So we want to do this by implementing the digital healthcare solutions that already exist into the markets, into the healthcare insurances. And as you might already know, Germany plays a very special role here because we have very strict data security regulation, while other countries where we work with already have all the things we plan to do, the electronic patient file and the insurance card. This already works in other countries of our partners. So what we do here, for example, we see very good innovations, very good startups that are not able yet to bring their products into the market here, but that are easily implemented, for example, in Slovenia or Austria or another country. So our goal is to bring innovation into another country, to make showcases and to open the doors also for those innovative services and products. So facing the fact that we want to bridge the gap of the fragmentation, the question is, those of you who already work in the field, belong to a statutory insurance, a private insurance company, an innovative startup or major company in the field of digital healthcare, join us. Be part of us, and here's why. Because We want to use the project as well for giving you a stage to show what you have to offer, to show what Saxony has to offer, and how it can be implemented in other European countries. So you have the chance for gaining more visibility. You can get a brighter variety of feedback on your product and just grow your network, which I think, especially for a startup, is very, very important. So what I want to invite you, if it concerns you, which I hope, then I want you to be visionary and I want you to be selfish by joining us. Why I'm emphasizing that, it's because I want you to think beyond your product, your business plan that you already have created, and just take off your glasses and see what else can you do in the European system and where can you implement your product when it's not yet possible to implement it right now here in Germany. And the selfish point of view, of course, at least you are also a patient. So think from this perspective, what do you want to have for yourself in the healthcare system? And maybe this gives you a deeper or awakes your inner driver much more. So just think about those facts, or if you know somebody who is working in the field, please just pass my contacts on, because I know a lot of very good ideas here in Leipzig and in Saxony, and I really would like to learn about more, to integrate them into our learning hub, into our working groups, and also to showcase Saxony as a best practice case in our project here. So my open invitation is get on board and take out your mobile phones if you like, hit the QR code and register for our quarterly newsletter. Here you get deeper insights into our working packages and the working groups. Of course, also when you talk to me, but I didn't want to use this to go very deep into the project. So here are my contacts, please. If it concerns you, I'm very happy to learn about your project, your idea, and if you know somebody who fits in that, please pass on my data. So that's it from my part. Thank you very much for your attention, and if you have questions, I'm available for you.